right, this is the one that we saw that discharge from the great toe sound. And that's not anyway, but look at this, it's not direct resistant. However, it's very similar to meron. The penance, or carbopenance, is what you call it. This is one of them. We're going to use this in clinical practice once we use the meron. Very similar. Is she on meropenem right now? Excellent. I'll take her of that. The other thing to look at is a creatinine. Yeah, so that's kind of climbing also. Lactate C, there's hardly any change in lactate. This is type B lactic acidosis. It is tumor related. And we did the paracentesis. There are 10% other cells. It's probably malignancy. Do we have any surgical stuff here? Where is it on GY and cytology? We didn't send it. The next time we'll send it. For some reason it didn't get sent. That's okay. There's some numerous issues here. And that she is, she's not. Procalcitonin has been elevated. Okay. Alright, so a lot of things are going on here. Okay, I just want to talk to you about it. First of all, how was she last night? Somebody spent time with her?
Yeah, she was very restless last night. She was trying to get out of the bed last night.
She would be. She was basically encephalopathic. It was a confusional state from multiple metabolic abnormalities. One second. Can you breathe in and out? Respire. Ask her to open her mouth. Excellent. She's following all the instructions very well there. Can you ask her to put her hands up for me like this?
Can you put your hands out in front of you, Mama? Up. Up in front of you?
Up.
Yeah. Can you do the other one?
Little flaps. Okay. Let me get an alcohol swab. Yeah. Okay, so, she has the liver cirrhosis,
Yes.
she has the cancer,
Yes.
and she's been getting fluid removed from the belly,
Yes.
on and off. That fluid probably has some cancer cells in it, because we saw previously when we drained some fluid, we sent it off to look for the cell types in there, and they just didn't end up sending it to the pathologist to finish the final thing on it. But
Gotcha.
we do see a lot of abnormal cells there. I think some of them may be cancerous. More than that, kidneys. Her kidneys are kind of going into more and more failure, and part of it is all the different times that she has gone through pulling a fluid from there. So the body kind of gets dry when you pull a lot of fluid, and it just happens in every patient that we've sent to the radiologist for that. It just happens. That's how the body is. Sometimes it builds up, little drynesses literally build up, and they don't get better at the kidney level. So when you do it the 5th, 6th, 7th time, the kidney function can get worse. Okay? Now, having said that, the other thing is, remember that toe that we looked at last time?
Yes.
There's some pus coming out of there.
Yes.
There's growing a germ from there, and I actually did ask for possibly an MRI of that foot. Was it ever done? And it was supposed to be done without contrast, though.
Phase.
Was it a bone scan?
Yeah, we did the triple phase.
Okay, good. So, do we have a report on that? Right, so that was more superficial then. Lateral tarsal bones. Okay, so it is close to the bone, but not yet in the bone. Thank you. So I did a scan for her last week, and we're worried that because the area is so close to the bone, sometimes infection can settle down in the bone itself and can cause something osteomyelitis, which takes weeks and weeks to treat it. Fortunately, it hasn't gotten deep into the bone yet. It's more on the outside under the nail. So what she has something we call paramechia. Okay, paramechia is the medical term for it. It just means a nail bed infection.
Okay.
Instead of this being a fingernail, it's a toenail. That's the only difference.
Okay.
Okay, it's a toenail infection in plain language. So numerous things are happening here.
Yes.
And the other thing is because she is cirrhotic, her clotting factors are very low.
Mm-hmm.
And there is no way to cure that. You can't cure any of this. You can make things a little bit better with lots of heavy duty management, okay? But the only time that she can get this type of management when she needs it is when she's in the hospital.
Right.
You can't do any of this at home. So there is, unfortunately, not a whole lot that we can do in terms of curing anything.
Right.
We really can't cure much here. The kidneys are a concern. Now, we need to do urine for eosinophils in her. Did we, right, you can add on if it's not done. That's fine. It was negative?
Yeah.
Then
Okay, can you kindly repeat that one more time?
that was this morning.
Or was it? Okay, then you don't have to repeat it. Okay. So, whenever the kidneys start to go into failure, waste products will build up in your system, it can make you really confused. Plus the infection. The kidney failure, of course, we just mentioned that, okay? The liver cirrhosis doesn't make anything better. You build up ammonia, even if you're not eating much. You've got bacteria in your gut, the ammonia can climb. There are about 4 or 5 different things that are making her mind confused. And she is so bright that even when I talk to her, she understands what I'm saying. A lot of people will not be able to even follow what I'm saying when they're this sick.
Yeah.
So she's naturally bright. See what I mean? And then she is already having what we call encephalopathy, which means brain dysfunction from multiple metabolic internal derangements. Okay? So in her case, she's not a great candidate for aggressive care for the cancer. She's not gonna get better. It's just gonna make her miserable. And she will not leave the hospital. She will just stay on and keep coming back with one problem or the other, infection in the belly fluid, infection in that toe area, in the urine, you mentioned it, she'll have it. So you might wanna start to think about doing what we call palliative care, where you don't wanna flog a horse that's tired. What are you gonna get out of it? You want it to run, but it will slow down and it will crash one day. You wanna be kind to them, okay? So I think it is very appropriate at this point because she's such a sweet person going through all this stuff, and it's really sad, but we need to try to be considerate here. I will get palliative care to come and visit with you guys, and they will basically discuss about like pain control, discomfort control, and transitioning her to transitional care type of thing like hospice. Because you need to be able to at some point take her home and let her be in her own house and see whatever time she has left. She needs to be seen a place where she knows everything there, rather than be cooped up there in the hospital. So all those things come up here at this point. Do you have any questions?
No, that is something that the nurses have been kind of informing me, and they gave me a list of some rehab facilities that could possibly be an option also.
Yeah, she will be too weak for rehab because
Mhm.
she will not be able to participate the requirement of 3 hours of exercise in rehab. She will never be able to do that.
Okay.
So she may, if it's hard to take care of her at home because you guys work and nobody can stay with her all day long, you can think of maybe a skilled nursing facility with hospice component within that,
Okay.
and they can work on that. Our social service people are pretty good, so they can work that out with you guys.
Okay.
Okay. I'm gonna continue to treat her as I am now. I need palliative care to come and also see you guys, because they are our friends, and they
Yes.
come and help us out with these types of cases. And then we can even think about possibly either keeping her here until that happens, when she can maybe go to a facility,
Mhm.
or she can go to the palliative care floor, where it's a bigger room, and you guys can go there with other relatives, and they can continue to take care of her things that are important at this point.
Okay.
The other things we are doing is just temporary, it doesn't fix anything.
Right.
It just continues to linger make her linger on with more sufferings accumulating with time. Okay? That's the thought process. Alright,
Okay.
so let them come and see you guys, then you guys reach a decision, then we'll go from there.
Okay.
Okay?
All right.
Alright, see you guys later. Bye-bye.
Thank you, Dr. T.
You're welcome.
Anything about the pain?
About the pain.
Oh yeah.
Yes.
Is there something different that we could give her besides the morphine?
Yes, we can,
Okay.
absolutely. And that's why I'm actually calling them on the case as well,
For the
because
palliative?
they'll manage all of that.
Yes. Okay.
Okay, no
Thank
problem.
you.
Thank you.
Thank you.
Thank you.
Thank you.